Okay, so digoxin fits into the classifications of inotropic agent and cardiac glycoside. For now, we're going to use those terms interchangeably. The brand name for digoxin is Lenoxin. Okay, it comes from a plant. It's very old. It's called the foxglove plant, right? And cardiac glycosides, let me just explain this to you, and then I'll narrow it down as to what you really need to know, okay? So cardiac glycosides work by inhibiting the sodium-potassium ATPase, okay? And that causes calcium to collect within the cells of the heart. Calcium assists the proteins actin and myosin to interact, and this increases cardiac contractility. So what we see is increases cardiac contractility, affecting sodium, potassium, ATPase, and affecting calcium. Okay, that's plenty. That is definitely plenty as far as the biochemical side of it. Okay, we can say it in fancy terms all day long, but that's really the bottom line of it, okay? The next thing that you need to know is that it increases the force of contraction in the heart. So I'm going to just put this on a different sticky note. And this is part of something you might see on the NCLEX. It does have a positive inotropic effect. So an inotrope is something that increases a positive inotrope is something that increases contractility. Okay? That helps to increase cardiac output. And again, if you need to review the cardiac output in this cardiovascular section, there's a wonderful review of cardiac output that was probably done in pathophysiology and in physiology, but again, it never hurts to go back and remediate, right? So that is one thing that it does. Okay? Then there's this, there's a decrease in angiotensin II in response to the change in arterial pressure, and it decreases vasoconstriction. So it allows, so in saying decreases vasoconstriction, that means it's more of a vasodilated state. This means that there's less of a systemic vascular resistance, meaning that the heart isn't working as hard, okay? The kidneys also can excrete a little extra water and sodium. Okay? Cardiac glycosides also increase parasympathetic tone. Okay? So that means they decrease the sympathetic nervous system's tone in addition to increasing parasympathetic tone. So if you want to go back to that, we're increasing parasympathetic tone, which that sympathetic nervous system tone was actually really hard on the heart. So by decreasing the sympathetic nervous system tone, it is making the heart more effective within that body. Why? Because that's a heart that wouldn't survive getting chased by a bear, right? So we've got to bring it out of that being chased by a bear state, okay? All right. It also, because of that increase of parasympathetic tone and decrease of sympathetic tone, it brings the heart rate down. Okay. We could call that, if you ever are interested, negative chronotrope. Is there an E at the end? I can't remember. I think it's got an E at the end. We'll put chronotropic. So, at any rate, because of this reason, because of this, so this is all how this medication works, okay? This one we have to talk about lots of things about how it works because it's got lots of effects. What's confusing to people is that it actually increases the force of contraction and increases cardiac output. So it does not lower blood pressure. Write that down. Digoxin is not something that lowers blood pressure. Okay? What it does lower, though, and I want you to make this connection, what it does lower is heart rate. So it can cause bradycardia. Okay? And so I'm going to save that. And this is why, I don't know if all of y'all checked apical heart rate in your Skills 1 class. The reason why you were checking the apical heart rate for a full minute is this is one of the patients you're going to check an apical heart rate for a full minute in. And you can bet your bottom dollar when you get to that NCLEX, they're going to want you to know where that apical heart rate is. And if you don't remember it, you need to go back and relearn it in your skills modules. Okay? But I can tell you, right? It's find that angle of Louis, go over to your left, to the second intercostal space, count down to the fifth intercostal space, and use that intersection between the fifth intercostal space and the mid-clavicular line, mid-clavicle. Use that intersection, and you will find your apical heart rate for most people. However, just keep in mind, these are people with heart failure. So you might have to move it over to the left a little bit in order to actually hear it. Okay? So that is one of the things that's really dangerous. That's why we check the apical heart rate. So that can happen just because that person started out with a low heart rate, or it can happen because of an adverse reaction that it just brought that heart rate down so far. So what I want you to remember is that heart rate needs to be 60 per minute or greater. Okay, so you're going to hold the digoxin if that apical heart rate is less than 60 beats per minute. Now, you're going to probably need to think about this and chew on it for a while, honestly, but I'm going to tell you something. We're checking the apical heart rate because somebody in this significant of heart failure doesn't always perfuse all of those beats. And we want to know what the actual beats are at the heart. Okay, so you can rewind that, listen to that 8 times, and chew on it for a bit. Okay, please do. I want you to think about that. Okay? So one thing you do need to know are the signs of toxicity. Okay? So toxicity in digoxin is not just something that is on the NCLEX. It's something you might see in real life. Okay? So there's a number of things in people's lives that can put them kind of out of whack, right? And so people can be put into kind of an over... if people are, how do I put it? If people are not in a normal homeostatic state, sometimes it doesn't even take the change in dosing to cause toxicity, or maybe they've changed a different med, or maybe they've gotten sick, or maybe they've done this with their... toxicity can be something that can occur no matter how long they've been taking it, whether we've gone up on the med or not, it just can occur. So a very, very low pulse, that would definitely be present with toxicity. Dysrhythmias, okay, because of non-perfusion of the heart. There's also something I want to let you know about, and I'm going to try to pull something up for you here. There's also something that's very, and I remember this exactly on my NCLEX. So you can bet your bottom dollar that this is going to be something that is going to be important. Okay. Miss the H. Okay. So people will report visual disturbances. So visual blurriness. But the one that was really, really apparent on my NCLEX, and I knew right away, was this yellow halo appearance called xanthopsia. Okay? So this yellow haloed appearance called xanthopsia. And that is really important. That could be on your NCLEX, right? I mean, and then what do you want to do? You want to check the digoxin level, right? So when you check the digoxin level, let me bring this forward here. When you check the digoxin level, if it's between 0.8 and 2.0 nanograms per mil, you're good. You're good. If it's greater than 2, yeah, it's toxic, right? You would hold it and call the provider. If you noticed any of these toxic symptoms prior to giving it, you would do what? Hold the med, call the provider. The provider would probably order a digoxin level, and you'd go from there. Okay? So let's say your digoxin level is 1.5. In the chat, go ahead and let me know what you would do. You'd administer the med after checking the pulse. I love that you did that. I love that. I love that. I love that. You rock. Okay, so the antidote to this, right, is Digibind. That binds the digoxin so that it is not free to cause problems. So these are really the major things that we need to be thinking about. Toxicity is one of the big ones. And there are a million other things that can go with toxicity. A person can be nauseated, vomiting, all sorts of, kind of normal things, right, that somebody might experience. So let's put those in there. But really that halo appearance, that should give it away, because there's barely anything else in the world that produces that halo experience, okay? So, so it can cause the pulse to be irregular. It can cause nausea and vomiting. That's whenever you see us abbreviate NV, that's what it means. Fatigue, confusion. The confusion is because of all the things it does to sodium. And whenever somebody has an odd sodium level, it's not within the normal, it's either high or low. Sodium will make people confused, right? And then anorexia. And anorexia means they're not hungry. It doesn't mean that they're that they look like a runway model. Okay, so I can go ahead and I can stop that.